Steroid flare following a knee joint injection. Top frequently asked questions. What is a steroid flare following a corticosteroid knee joint injection? A steroid flare is a term that refers to a common side effect following a joint injection with corticosteroid medications. While corticosteroids are given to decrease pain and inflammation, in a small percentage of patients they can temporarily increase pain and inflammation. These episodes are usually brief and self-limited. Additionally, they usually occur within a few hours of having an injection. Corticosteroid medications such as triamcinolone acetonide and methylprednisolone contain crystals suspended in liquid. It is thought that the settling of these crystals in the joint can cause a temporary inflammation seen in a steroid flare. Corticosteroids such as dexamethasone phosphate, which do not contain crystals in suspension, carry a lower likelihood of a steroid flare. How is a steroid flare treated? The treatment of a steroid flare is symptomatic. Treatments such as ice packs, rest, acetaminophen, and over-the-counter NSAIDs such as ibuprofen or naproxen are typically used for 1 to 3 days until the symptoms subside. Although the steroid flare is generally benign and self-limited, similar symptoms can also be seen in a joint infection. A joint infection is not benign and requires immediate medical attention. Although a joint infection following a corticosteroid injection is very rare, they do occur once in several thousand injections. Generally, an infection does not become symptomatic as quickly as a steroid flare. An infection usually takes significantly more than 12 hours to become symptomatic, sometimes several days. However, if after having a joint injection, the joint becomes very painful, swollen, limited in motion, reddened, and or inflamed, there may be an infection present within the joint space. The problem is known as a septic joint. If this occurs, immediate medical attention is required to avoid more severe infection and destruction of the bone, as well as prevent infection throughout the entire body. In this case, antibiotics by intravenous routes are usually necessary and surgical drainage may be required. While steroid injections in joints can be very helpful to decrease symptoms of inflammation, they are not without side effects and risks. These range from minor nuisances, such as the steroid flare discussed, and other problems which resolve on their own without any treatment, to rare, severe side effects that, if left untreated, can result in destruction of the joint, loss of the limb, or even death. It is important to maintain good communication with your physician if you have any unexpected side effects following a medical procedure.